Thank you very much. So, Alison, we discussed, and what I'll be doing today is, obviously we're still very much in the midst of this pandemic. So I won't be speaking directly to the post-COVID UN post-COVID-19 roadmap, but specifically to the work that we jump-started right at the beginning of this pandemic in March of this last year. Actually, we are in 2021, to address this pandemic. Are you seeing my screen?
I'm seeing the screen, but not your slides. So
okay, great.
There they are.
Now?
Yes, and you might want to and put those on slideshow.
There
we go.
So, great. So the African Academy of Sciences has, over the past decade, been building up programs, as I said, to strengthen this scientific base in Africa. And so when the pandemic started, through the COVID-19 response team at the African Academy of Sciences, through the ASA platform, we were able to undertake some very quick response activities, which I will outline here, then going into a program on science policy engagement, which I think is very crucial, even during the pandemic, but also in the post-COVID-19 recovery phase for this evidence-informed policy making to inform how we address those three intersecting of equality, the resilience. I took a photo of that picture because I think that's very crucial, which he outlined, was on looking at very much those three areas in connection with each other, which is let me go to it quickly. It's not in my presentation, but it's equity, resilience, and sustainability. Very crucial, and that requires policy that is informed by science. So let me not go on to this. I just gave you the outline of who the Academy is. So when the pandemic started on the 25th of March, we hosted a webinar with 275 scientists from across the continent. And because of the way we organized through our fellowship and affiliateship and our grantees, we were very quickly able to mobilize these scientists. And very importantly, what this survey was to collate the research and development priorities for Africa. This report is available. We will host it on the expo area of the Open platform. And what we did is we identified 17 new priorities, which are specific for Africa. And these were based on the WHO coordinated global research map, and through an online survey, plus this webinar, we were able to come up with specific research priorities for Africa. And this is very important. The research priorities and how this pandemic is taking place across the world is different. We share common challenges, but there are also specificities which are really important for us to address. So we also then developed the expert database of COVID-19 experts and researchers working on this COVID-19 pandemic. And this, very importantly, an AAS clinical trials community, which was already being developed before this was quickly a minimal viable product was launched, was to look at what is the research expertise that exists on the continent to undertake clinical trials. We updated the survey. Really importantly, we also got funding for COVID-19 research and development priorities from our funding networks, and a call was launched on the 1st of May. And currently we are involved in a science policy learning platform for looking at how specific countries can be assisted in their response strategies to COVID-19. Because there, as we say, even at a continental level, we're different from the global response, but even at a national level, it's really important to look at the specificities. So these are the two reports that were launched very early on, this research and development goals for COVID-19 in Africa, and then an update that was launched later on in the year. The clinical trials community, which is looking at the burden of COVID-19 in Africa, looking at the clinical trials landscape in Africa, and institutions conducting clinical trials in Africa, is a very important platform. And I encourage people to go to this website, ctc.africa, to look at the different tools, information that's available to the community. We launched this core, and this was launched in May. Some of the areas are outlined here: clinical management, candidate therapeutics, virus natural history, social sciences as well. In the outbreak response, we consider that social science responses are very crucial as well during this pandemic. These are a list of some of the projects that were selected for funding, as you can see, from a variety of countries, Nigeria, Uganda, and others, and in a variety of research topics. So I want to now then quickly go to the next steps, which is what we are doing this year, which is looking specifically at the science policy engagement. It's a partnership with the Africa CDC, Africa Center for Disease Control, WHO Afro, and in the various AAS COVID-19 policy action areas. And this was from the priority research and development areas. Various expert groups were then set up to look at which are the most critical areas which need further research at this stage. And these were the very broad areas that were identified. Very crucial for us to understand. We won't be doing evidence synthesis on these broad areas, but by engaging with country-level governments, we're going to be starting with Malawi and Cote d'Ivoire, and regional bodies like the East African Community. We will have teleconvenings with these organizations in order to assess what is the specific research question that they require to address specific policy concerns. So I just wanted to mention that we are working with the African Center for Disease Control, and specifically the Africa Task Force for the novel coronavirus, and which has been very crucial in preparing the response to the global epidemic. The African Academy of Sciences are working with them, and other regional bodies, including the African Union Commission and WHO Afro, as mentioned, to bring together policymakers and scientists to ensure this kind of evidence-informed response during the pandemic, and we will continue this through this learning platform post the pandemic. So what we will be doing is through these teleconvenings, bringing together the people, but very importantly, it won't end there. We want to, through the process, identify specific research questions from the areas that we outlined, but also broadly from areas from the specific country response strategy, from the UN research roadmap, that they identify. We want this to be demand-driven. Very importantly, for people to act on the information, it must be responding to a need. So for us, that conversation with the policymakers at the regional level is going to be important. Then we're going to commission these rapid research syntheses on these identified issues for policymakers, where they identify more information is needed. Also making sure that they developed into policy briefs that these policymakers can then quickly use with actionable recommendations that can inform them. And they will be disseminated through the partner organization, including through the African CDC website and the African Academy of Sciences website. So what we're wanting to create for now, while we're in the midst of this pandemic, but also very importantly to address this important 5 pillars and 25 research questions that Dr. Hoffman outlined, is to create this consultative science policy learning platform for stakeholders to continually discuss the challenges, determine concrete policy options and strategies for tackling the pandemic and the post-COVID recovery, access and the science, understand where the science is, how to access the best reputable sciences, and ensure that we're not using questionable sources, to deliberate on this and look at African evidence-informed policy solutions, and identify practical and opportunities for coordinating the STI interventions in Africa during the pandemic. And very importantly, for this period and going forward, to foster collaboration between the various Pan-African, regional and national organizations science organizations, but also very importantly the policy organizations, and how then do we work in concert with these international organizations, including the UN, the ISC, and others in our response strategies. So what we're wanting to invite national or regional organizations from Africa that are participating in this session to contact the African Academy of Sciences to be part of this project. And here are the contact details of the people that you can get in contact with. Myself, who is Dr. Esteban Naika, who I'm leading the Science Policy Engagement team, and Dr. Moses Olobo, who is leading the team which is developing the research and development priorities for Africa. So thank you very much. And
thank you very much, Dr. Naika. And I can invite now, if you want to stop sharing your screen, I can actually invite those who are in the session we can actually come in and have a group chat as if we're in a room. Yes. So perhaps Martin, Dominic and Fanny Dellinger, who've both asked questions, if you click the button to share your screen and your mic, perhaps we could even bring you in and start having a conversation. So I think Martin has come in. Martin, are you there? Here he comes. Hi, Martin. Welcome. Welcome to the session. You have a question for Dr. Naika, so please go ahead.
I was wondering, just looking at issues that are of specific importance to the African continent, do you see some ways where Africa is leading the way on the world stage? What is Africa doing better than others, or what could Africa do better?
Well, I think Africa, because of our high disease burden, we have, set up addressing malaria, addressing the Ebola crisis, and others have, looked at, have the necessary capacity where needed. And we live in a very uncertain continent. I mean, maybe we are used to uncertainty. I think we are a very resilient continent in terms of political, but also, in terms of disease burden. So I think this goes to the nature of the people on the continent, but also the systems that we've created. I mean, because it has to address these specific challenges that we face. I mean, when you go into the developed world, you probably used to more certainty, things working a certain way, whereas here we used to not. I mean, any traveler to Africa, and I think that has prepared us for this. It's not a good thing in most circumstances. I think we would really like things and systems to operate very well, but I think it creates a personality within Africans. And then also in terms of the kind of researchers we have, who are very quick to be able to respond. I'm then posting, someone asked why are the death rates so low. Two of my colleagues, Dr. Kevin Marsh and Dr. Moses Olobo, have written about this. And it speaks to some of these issues. The link is posted in the chat right there. Why Africa's death rate is so low? There's various reasons. Some of them are through our personal experience. Some of them through just trying to consider and think about why that is. But I think they're various. So I recommend you read that article. But what was also been really great right from March, when we started this process of the COVID-19 research priorities, the community was very strongly activated, and through organizations like the Academy and other regional organizations who have strong relationships with funders, including the National Research Foundation in South Africa with the Science Granting Council's initiatives, which works across the African continent to strengthen the research systems there. They also launched a rapid research call for COVID-19 research. And we were able to do this thanks to this collaboration that we've developed in this past decade, but also through our international partnership.
Eduardo, you've joined us. You can ask your question live.
Okay, hi. This is Eduardo Cosentini speaking. I am President-elect of the International Union of Soil Sciences. And I was wondering if there are already priorities that have been identified for Africa, and if agriculture and soil in particular are taken into consideration, because we have the ambition that actually is just caring about soil, that you can cope with not only the pandemic, but to improve the condition of the world. So I'm wondering if you have taken into consideration this aspect.
That's a very interesting question, but within this, there's been a wide variety of areas in the social sciences, but not necessarily in conservation, soil sciences, food and nutrition that have been identified. But through another project, and this is very important for us, is that while we have this COVID-19 research and development priorities, there's another project which we have around African scientific priorities, which is a project that is running in parallel. And actually, one of the reasons we were quickly able to activate the network was we already had that prioritization project going. And through that, definitely we have food, and it's under the umbrella of food and nutrition security, that soil sciences and taking care of the soils in Africa have been identified. We can share the report that's been produced through that scientific prioritization exercise. But an interesting question there, Eduardo. It hasn't been. I think people are so focused on tackling the immediate challenges, which are mostly medical, that we also needed to alert people that the social science aspects of it needed to be addressed, including mental illness, gender-based violence, macroeconomic issues, and the impact it's having on the already very high rate of unemployment in Africa. But going into these areas, not yet.
Yeah, I think that's a very interesting question about the. I mean, for those people who don't know, we're halfway through the soil decade, which the Soil Science Union announced 5 years ago, and it speaks to what Dr. Hoffman talked about with the three legs of resilience and sustainability and equity, that we need to bring in all of the sciences. Sam has a question, and Sam, if you want to ask it directly, you can open your you can ask to come in, but I'll ask it to keep on going. And here he comes. He's asking a question that's very passionate to my heart, which is about the infodemic.
Oh,
yeah.
Yes.
So in fact, he was there and now he's not. So you can probably see it there, Dr. Naker. He's asking about accommodating human behaviour and how do we translate scientific knowledge into common knowledge so that the ultimate stakeholder, the public, embraces more appropriate social behavioural norms. And I was actually in a session a couple of weeks ago with the WHO's pandemic response team, the communications team, which is based in Cairo, that's going to be running a pilot on the continent just on that very issue of knowledge and misinformation. And, on a continent where most people have a mobile phone and the ability to have misinformation spread, I mean, that's got to make the recovery harder.
Absolutely. However, what we're hearing, in terms of vaccine hesitancy, it's not just Africa. I mean,
No.
surprising, coming from Germany and very, so advanced economy. So, I mean, it's really challenging that, if you're having this problem globally, it's not just an African problem. But in terms of addressing that, I mean, this has also been something that I'm passionate about. And I think I addressed this in a piece I wrote in the conversation around the voices missing from, the expert input into COVID-19. And I think it's civil society organization. Mm-hmm. You don't speak to them after the fact. I think it's really important when we put experts come from the scientific fields, but also people that are very expert at work at community engagement and identifying what communities will actually identify with messaging, because scientists, we find it difficult to write for policymakers. Imagine writing for, the general public. It's even more difficult. And I think they're, engaging with science communicators, journalists, but very importantly, people who are working on a day-to-day basis with those communities who would assist you with the messaging. And for work we do, science is crucial, but I think science engagement with the different communities, policymaking, yes, but also the general populace that are affected by this, because unless you speak, like all of us, unless you've spoken to and asked about a solution, it's, there's more likelihood of you then buying into the solution. In many interventions that I know that, even the UN through the SDGs is undertaking, it's not about an after the fact. So crucially, I think that misinformation is rampant, as we know, coming from high offices within Africa. The situation that has taken place in some countries in Africa with misinformation that are coming from high political offices and policymakers is, untenable. But we know that's happening globally as well, not just in Africa. So I think because they have access to them and they speak directly to people within their constituency, scientists need to also work with people that are constituency based within civil society organizations and make sure that they get speaking to those communities. And I think that's the only way to tackle.
Yeah, I really like the way the WHO office for Africa on communication was they spoke about communities, and they didn't just speak about a traditional type of community in a physical way. They spoke about communities online and the need, to bring in young people and creating those kind of new communities. It was really interesting and powerful. And you're right. The vaccine hesitancy just doesn't happen on the African continent. It's happening everywhere, and we're going to have to find ways to deal with that, because obviously herd immunity happens in two ways. It happens naturally, or it happens more quickly, which is what we want with the vaccine.
Could I just interject there? While this in misinformation is a crucial aspect, I think in Africa what we are dealing with is also this lack of access and this inequity already in access to vaccines. And we really, we want to speak to the community, in global community, that herd immunity needs to be achieved not country by country. It needs to be achieved globally. So the access for Africa and, the assistance that we are receiving already it's great, but definitely in terms of people getting 2 times the amount of vaccines that they need and stockpiling, that conversation really needs to start happening about, you can't expect, people to tackle this hesitancy, but when they are ready, there aren't vaccines available. And we really need to get back to those basics as well. I see.
Is there another question that's come in? Yeah. Well, I know it's just about education. Is that what you were looking at? Yes. So just to finish off this, you're absolutely right, and I think there are a lot of parallels between climate change and the pandemic, where there's nationalism, but actually this is a global problem. And in fact, the Washington Post today's editorial is on the need for countries to collaborate more effectively and not have vaccine nationalism. So I think it is starting to be discussed at an urgent level, which is good to know. We have 2 more minutes, so let's go to Fanny's question. Unfortunately, Fanny wasn't able to get her mic working, but she wants to know about the information on the effect of the pandemic on education. Because obviously, I can speak from a European perspective, many schools have been closed and we're using Zoom, but again, we have an internet that's quick, people have access, it's uneven. What's happening with education in different parts of the continent, to your knowledge?
Well, the African Union, through the Specialized Technical Committee on Education, Science and Technology, convenes the ministers ministers of Education, Science and Technology, and they've had about 3 virtual convenings during this pandemic. And UNESCO has also come to the table as a various private sector partners on the continent, mobile providers to assist governments. And this is what we heard there. We are working specifically in the science and technology space for our grantees have been, made it clear that support that's required for internet, etc., is there. But for schools and this inequity in Africa and this digital divide between the hubs is very much. And I mean, what is crucial, I mean, and what's important, and it's these various things that the pandemic have brought to the front. So people will now have access that who were privileged before. So I think African governments have come to the table and sought to partner with relevant organizations, multilateral and private sector. Much, much, much more needs to be done, and not just for the short term, but for the long term, because to address all of the SDGs and the crucial 17 goals, I think we recognize that data, information technology, science, access is really important. So unfortunately, it takes a crisis to focus the mind, but we hope that this crisis focuses the mind to address the challenges now, post-COVID-19, but into the future, so that we can tackle the Sustainable Development Goals effectively.
Well, Dr. Naicker, that's a perfect way to finish this breakout session, to bring in the 17 Sustainable Development Goals, and again, that eye on resilience and equity and sustainability, and the need to capture all of these in our imagination, and that one goal is not going to work without the other 16 goals to coming along with it. It's a huge task, but I think, as Dr. Hoffman said, 2020 woke us all up. There's an urgency. Governments are starting to think about cooperation, and science is starting to really take a centre stage. And that's something that the International Science Council is really excited about, and we want to leverage our membership and our global voice to make sure that we're up for the challenge. Well, look, we're coming to the end, so can I thank everyone for joining this session. I am just going to put one more link in the link section for our SDG Interactions publication that speaks to that. I encourage you to go networking by clicking on the networking button, and it will randomly place you with someone, just as if you're in a coffee break. And I invite you to join us tomorrow at 8 o'clock UTC time, that's 9 AM Central European time, for our Transformative Pathways discussion with EASA. Dr. Naicker, thank you so much for joining us. I really appreciate you giving us the African perspective, and I hope you can join us for networking, and maybe somebody random will be placed with you to have a bit more of a conversation.
Thank you so much, Alison, to the International Science Council, but also to Dr. Hoffman for inviting me to participate in this session. And please, the invitation that's open to the African organization, but it's also open to international organizations to work with us.
Thank you, and people can find your email on the slides if they go back into the expo. Yes. Thank you so much, Dr. Naicker. Yes. Thank you, everybody, and good afternoon, and I'll see you for networking. Bye-bye.
Thank you very much. Bye.